But I think it's very important for the, once you compare for the GI pharmacology, for the anti-ulcer antithesis is very important. This line is I should do the presentation. This line is the list of the motor drugs. We're gonna learn all about this. It includes all the three parts together. And the learning outcome for this part, like the other part, we need to know the mechanism of action, therapeutic indication, adverse effect, and the unique characteristics of the drug disposition. And the other thing from the GI tract part, you need to know about the normal physiology and pathophysiology of the GI tract. Okay. We're gonna come back to the stomach part. And stomach, the most commonly found condition in the clinic is the hypergastric secretion, and that can cause the gastric ulcer. On human, they call it peptic ulcer. And the ulcer is most commonly found in dogs, cats, and horses. But the horse, they have a different part. They can be like the stomach or maybe the colon part. And before we move to the pharmacological, we need to review about the normal physiology or the normal histology of the GI, of the stomach. This is a monogastric animal, the stomach from the monogastric animal. They compose like a 4 parts together, which is include the fundus, body, antrum, and pylori. And the part of that secrete the acid is the body, antrum, the pylori. I don't want to memorize all the cell detail of the stomach epithelial cell, but I want you to memorize that parental cell, mucous neck cell, or we know as the young epithelial cell, surface epithelial cell, we call the G cell or gastric or the E cell. Yeah, that's all, not all the cells. Pretty much almost of that. For the parietal cells, is the blue cell right here. Is on the gastric prick right here. Is responsible to produce of the acid for the stomach. And how they produce it? They have 2 pathways together. First is from the calcium-dependent pathway, and that pathway is stimulated by 2 receptors, which are the muscarinic receptor and CCK receptor. And that muscarinic we know is acetylcholine as always. But the CCK receptor, they stimulate by the hormone we call gastrin hormone. That's gonna stimulate to the calcium-dependent pathway and gonna stimulate for the potassium and hydrogen ATPase pump. And this pump is the potassium go to inside the cell and hydrogen ion outside the cell. And we know the hydrogen ion is the acid and become the gastric acid to the stomach. And the second pathway is the cyclic AMP dependent pathway. And that pathway is stimulated by the histamine, especially the histamine 2 receptor and EP3 receptor. EP3 is the receptor for the icosanoid, and EP3D is stimulated for the PGE2. Icosanoid stimulate to the EP3. But for the prostaglandin or PGE2 is inhibit this pathway. So that's gonna slow down or inhibit the release of the gastric acid. For this slide, that means 3 mediators together that increase or the stimulate the gastric acid, which include acetylcholine, gastrin, histamine. But for PGE2, it stop or inhibit the release of the gastric acid. And if you recall from the NSAID drugs, because the NSAID drug, they gonna stop production of the prostaglandin, right? And the prostaglandin gonna be gone, and no the mediator that gonna inhibit the release of the gastric acid. So the gastric acid gonna be released more. And histamine, as we know, the histamine itself, it can stimulate both of histamine 1 or 2 receptor, but only histamine type 2 on the parietal cell that stimulate gastric acid. And the other thing is the gastrin. I think I have a slide. No. The gastrin, because from my experience, I found the gastric ulcer a lot in case of the renal disease in the small animal, both cat and dogs. And they have the theory, they thought like the urea that can cause a gastric ulcer. But the level of the urea, they have to have like higher enough that can cause the disrupt of the GI protectant or that cause the GI ulcer. But they the one they don't have the high level of the urea can cause a gastric ulcer. They found that it's not from the urea itself, it's from the gastrin, which means they have the higher level of the gastrin hormone. The gastrin hormone is excreted by the kidney in the urine. And when they have the renal disease, the gastrin hormone is cannot excreted. The gastrin hormone going to be accumulated to the blood system and going to activate to the CCK receptor, and that cause the stimulate the release of the gastric acid. You have question? But PGE2 is not only to inhibit the release of the gastric acid, it also has the effect on the superficial epithelial cell, or the neck cell, or we know the young epithelial cell. What they do, both of the PGE2 and PGI2 stimulate at the EP3 receptor, and that stimulate gonna cause the production of mucus and bicarbonate. Bicarbonate have the basic property. They're gonna neutralize the gastric acid. And once the mucus and bicarbonate combine together, gonna create a mucus layer. And mucus layer gonna protect of the gastric epithelial cell from the gastric acid or the enzyme or the digestive juice to digest to the epithelial cell. pH at the mucus layer is equal to pH 7. That means they can be neutralize the gastric acid from the stomach lumen. But to increase the stimulation, the production of the mucus and bicarbonate is not only from the PGE2 and PGI2, it's from the muscarinic receptor too. That's why we didn't use the cholinergic to treatment of the gastric ulcer. Because if we use the cholinergic to treatment for the gastric ulcer, they can increase, they can increase the gastric acid release, and they also increase the production of the mucus and bicarbonate. To to treatment of the gastric ulcer, so we have to slow down or stop the production of the gastric acid. Stimulate the production of the mucus and bicarbonate. And use any agent that's going to be covered to the ulcer to prevent from the gastric acid that's going to be disrupt epithelial cell. And the other agent is going to be neutralize the pH of the gastric acid. And this slide is just I wrap up the one I said in the previous one. And this slide is summarize about the gastric mucosal barrier. And the first one, and they have like more than 10 mechanisms that prevent from the gastric acid and the digestive juice that gonna digest the epithelial cell. But the seven, but I would like you to know that the one is important. Like the first one, they have the mucus layer. That mucus layer is gonna prevent from the acid and from the digestive juice. And the second one is the surface epithelial cell. It's lined up nicely. And surface epithelial cell gonna secrete the mucus, bicarbonate, and also prostaglandin. And they need to line up to cover on the stomach lining. And this cell have a turnover rate of growth very rapidly